Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic of my lecture is safe use of medicine. By using the medicine safely, we ultimately achieve the objective of patient safety. Here is the brief introduction of myself. Saira Iram Ijaz, a registered hospital pharmacist at National Institute of Child Health. Um, Also have some postgraduate degree, MPhil in clinical pharmacology from Karachi University, and masters in business administration, a specialty in hospital and healthcare management from Jinasan Medical University, with a background of graduation in pharmacy. The objective of today's lecture are describing the overview or describing the background of this topic, that why we use the medicine in a safety mode, and what are the requirements, the knowledge and the performance requirement to use the medicines safely, and if we if the healthcare professional and the physicians and pharmacists and nurses, yes, paramedics also did not take it seriously and did not take the medicines in a safety mode, it will happen the adversities and the events which are going towards escalation and increase of the mortality of the patient, and it may cause death or some sort of disability or some sort of injuries. So behind these kind of events, the negligence from the healthcare staff or some sort of mistakes or errors during the practices, which include the medication prescribing, dispensing, and administration error. These errors basically done by medical professionals, and sometimes they are also have not enough knowledge about the related events. So here I take this topic for you, that during the practices you should know about the uh, how many kinds of errors are there and what they impact on the patient, and while doing the services to provide the care, you may harm the patient. Your negligences or your low knowledge may harm the patient. Sometimes these kind of errors are due to the LASA or the high risk. The LASA is look-alike and sound-alike medicines, which may cause the harm towards the patient. These kind of errors are under the heading of dispensing errors. And the high-risk medicine, for the high-risk medicine, the practitioner or the professionals know that these medicines have the most potential towards the harm, but they want the desirability, they want the therapeutic effect of these medicines. So by controlling, by counseling, or and by monitoring, uh, they calculate the risk benefit ratio and prescribe the medicines with the monitoring environment, by controlling the parameters and strict monitoring, these medicine prescribed and dispensed. In the last one, I will discuss you a case study in which a patient um, lead to death due to this kind of error. So here is the information which I share to you about the medication error. This is the data collected in 2004 or published in 2004 about the Canadian Institute, and these Canadian Institute for Health Information provide the details that um, 1 in 9 adults contract infection in hospital, that from the 9 patients, one patient exposed to hospital-acquired infections and hospital-acquired diseases, and 1 in 9 patients receive wrong medication or wrong dose. That is, out of 9 patients, one should or one may receive wrong medication or wrong doses. These wrong medication may prescribed by the physician, the irrational or inappropriate selection of the drug, and the wrong doses by calculating by a pharmacist or by administrating by the nurses. So, the appropriateness, the rationalization of the medication, their calculation, their dispensing, their administration should be appropriate. Otherwise, it may cause any harm or any adversities towards the patient, as the next report, the next point in the report is more death after experiencing adverse event in hospital than death from breast cancer, motor vehicle, and HIV combined. That is Canadian information. Is from the Canadian Institutes, and Canada. You all know the Canada is a developed country, uh, not like us, and their health institutes are not like us. So, at there, the data of the death rate is for medication error, due to medication error, is much higher, and the death rate from the cancer, carcinoma, the accidents, motor vehicle accidents, and HIV are less than the medication error. By comparing the Health Institute of Canada and the Health Institute of Pakistan, if they say in 2004 that they have the more death, then some thought arises, then what was the condition in 2004 in our institute, and what is the condition now in our institutes? So this is the alarming information which was given in 2004 by Canadian Institute. Uh, Another, I have also the data from USA, which says the medical error are the third leading cause of death in the USA. The topic was designed in 2019, and all the these information gathered before pandemic. So in USA before pandemic, so I highlighted that this data, this information gathered in 2019, late 2019 or early 2020. So these all information gathered before pandemic, and before pandemic the USA give their leading cause, and the third leading cause was the medical error after the carcinoma, HIV, and again the motor vehicle accident, same was in the Canada. And after the pandemic, for your information, I've added these after the pandemic. The third cause is was now coronavirus. So we come towards a topic about the medical error. In 1999, U.S. Institute of Medicine, the United States Institute of Medicine (IOM) report reveals that medical error was to blame for 44,000 to 98,000 deaths each year in the U.S. hospital. This was the data gathered 22 years before, and uh, at that time the report says that medical error was the um, leading cause of death, and they give the numbers around 100,000 approximately death per annum. And a decade and a half later, almost this was the year 2014, the Macrae and Daniel attribute an even higher toll to medical error, and they give. You see, with the passage of time, the number of death increases, and here it is a number in the US hospital per annum, the death number, and it is the 251,454 deaths per annum, which is um, which is very much alarming for us. Again, I say that in the developed countries, in the developed institutes, where all the standard operating procedures and where all the standard practices implemented, if the medical error was the third leading cause of death, then what is in our country, what we are practicing in our country, it is very alarming for all of us, for all healthcare professionals. So it ignited scientific controversy about the basis of the estimate and the role of mortality as PSI, the patient safety indicator. You can calculate also the patient safety indicator in your institutes, inshallah, when you will come in the practices, that if the mortality rate just because of the medical errors, the medication errors, the dispensing errors, and the administration error, then patient safety indicator must alarm, must show the red alarm and ignite the topic. And we must look on the practices and the knowledge requirement of the healthcare professionals. So, what is in Pakistan? Medication error, yes, it is defined that it is one of the leading cause of death in Pakistan also, and wrong prescriptions, overdose of medicines, and adverse side effects of drugs top of the list of such errors that took human lives. This is the narration by the president of Pakistan Society of Health System Pharmacists, that is PSHP, and he says that as many as 500,000 people, including women and children, annually die in Pakistan due to medication error, which include wrong prescription, the overdose of drugs, self-medication, and adverse effect of medicines. So the four causes he described about the leading cause of death, and he say per annum 500,000 deaths in Pakistan due to these kind of errors. Along with the WHO, the World Health Organization report said that medical errors are the eighth leading cause of death in Pakistan. About 700,000 people per year are estimated to die from medication errors alone. So this is the figures which we receive from the different sources. Now come towards the knowledge requirement, what we should have during the practices of clinical pharmacy program, that we should know under the we should understand the scale of medication error, when and where and at what stage it will happen, understand the steps involved in a patient using medication. We should know, we should identify the factors that contribute to medication error. We should learn how to make medication use safer, and by categorizing the safe use of medicine, and by categorizing the factors which contribute to the medication error, uh, we should understand our responsibility, that we should aware of the uh, right use of medicine with the right drug with the right patient, and these all are the not only the doctor's responsibility but also the pharmacist's responsibility when he or she may prescribe or may dispense the medicine to the patient. Now come towards the performance requirement. After the knowledge requirement, yes, you may perform. You should perform in the healthcare settings, and acknowledge the medication safety is a big topic, and an understanding of the area. It will affect how you perform the following task. With this use of generic name where appropriate, you may reduce the medication error. Um, by tailoring the prescription for individual patients, that does not use unnecessary terminologies or unnecessary words or unnecessary alphabets or numerics in the prescription. The tailoring of the prescription for individual patient may reduce the harm, may reduce the chances of errors, may reduce the mistakes, the writing mistakes, the reading mistakes of the prescription. Another performance requirement is learn and practice through medication history taking. Yes, not only look the prescription of the patient, but also have some look on the history of the medication by the patient, or you may ask the patient about what kind of medicines he or she was taken for many years or for a longer period of time. So this may add the good performance in, and this may add the value. This may add to enhance the patient safety by reducing the chances of error. Sometimes you may also know which medication are high risk and take precautions. Yes, you may counsel to the patient that these medicines are at higher risk and you should take precaution. The healthcare professional also take precaution, and the patient also take precaution uh, in the regard by taking the medication. Um, and the medication you prescribe will, you know all the medications about everything about the medicine when you prescribe it. Use memory aids. Oh yes, some sort of acronym you may use in your mind about the data safety or the medication safety. Remember the 5 R's. Yes, this is the performance requirement for the pharmacists, especially that they also should know the 5 R's when prescribing and administrating. And 5 R's, what are the 5 R's? We will discuss in later. That is the right patient, the right drug, the right dose, the right frequency, and the right documentation. And then we communicate clearly. This is the very necessary thing that we should clear regarding about our previous knowledge, and we should communicate with the clear concepts, with the clear language, with the clear tone and clear voice that is audible to the patient or attendant, that how the medicines will take, and how many time and how much dilution it will take. So the communication is proper, clear, concise, and need any description you may describe it well. Develop checking habits. You should develop the checking habits that once you clearly communicate the patient about the medicine, you again and again check that it will take in a proper manner. When you are in a clinical round, if it will communicate with the nurses or paramedic or with doctors that how this medicine will take, how this medicine will administer. You may check after the communication. You will go in the round and check that the medication was used in a safety mode or not. Then next is encourage patient to be actively involved in the process. You should encourage the patient to involve in the process, to involve in communicating, to involve in telling you the problems in taking the medication. That if it is a oral medication and there is a chewing problem or the swallowing problem, or with the pediatric patient, the patient compliance is not there. So you encourage the patient by questioning, by answering, by giving the some tricks or some helpful guide to the patient that how you take, how you use the medicine, how you make this effective by with the attendants. You may talk with them and involve in the process and report and learn from medication error if it will happen. Unfortunately, it will not reported in our system, so you should take some learning about how to report it and when to report it and to whom it reported. So these are the performance requirements when you are in the field. Next, there is a WHO definition, World Alliance for Patient Safety taxonomy. That what are these kind of terminologies? Um, Elaborate in its sense what is the side effect. The side effect, if there is any confusion about the side effect and adverse effect, so you should clear it now in this slide, that the side effects are the known effects. The known effects, which are primarily known by the pharmacological industry, by taking these medicines on a clinical trial, they know that these medicines may cause this, this, and this. Um, Sometimes nausea, sometimes diarrhea, sometimes um, low blood cells count. So the side effects and the adverse effect. The major difference is the side effects are known and the adverse effects are unknown, so unexpected. So both are the undesirable effect, both are the unintended effect. But the one is known during the clinical trials. The pharmacological industry is known about it, and they publish it, and they get approval with these known side effects by the FDA, and WHO recommend that they must enclose this knowledge in the leaflet or insert of the medicine, that patient, when will the patient use it, they should know what are the side effects. So a side effect is a known effect other than that primarily intended relating to the pharmacological property of a medication, because the side effects are those effects which are due to the chemical nature of the drugs, and besides medicine produce the side effects, medicine also produce the desirable effect, the therapeutic effect, which is more required by the physician or by the patient. So sometimes it may ignore, and mm, they compensate or they manage with other medicines. For example, if the prescriber prescribed the opiate analgesia, and pharmacist monitor and counsel that it may cause nausea, so for nausea you take another precaution with the analgesia. But if the analgesia is required and the opioid analgesia is required, there is no other option with the prescriber, then he should give to the patient with the known side effect, and the pharmacist's duty is to monitor that any kind of effect has shown or not. On the other hand, the adverse reaction are the unexpected harm arising from a justified action where the correct process was followed for the context in which the event occurred. Now come towards, this is the very important point, that is the planned action by the physician, that he should give these and these medicines, that is 2 or 3 or 5 medicine to the patient, polypharmacy, and at that moment there is some, the plan was correct, the medication was correct, and there is a justified action by unexpected harm. No one knows about the harm. The pharmacist also not know about it, because it was not reported earlier. So unexpected allergic reaction in a patient taking a medication for the first time. There is no reporting about during the clinical trial. There is no reporting during the past history of the medication. There is no reports. Other patients take this medication well, and there was no reaction. But the specific patient in which the medicine given, there may be some allergic or hypersensitivity reaction arises. So these are the unexpected, unintended, and during the correct process, the harm was arises. So these kind of adverse reaction may produce by the use of medicine. The error during the adverse reaction is failure to carry out a planned action as intended or application of an incorrect plan, that is the not giving the right drug to the right patient, or your plan was incorrect so the error was held. An adverse event as an incident that results in harm to a patient, and we are talking about these adverse events that this is due to some cause of negligence or ignorance by the healthcare workers. So the next we are going to describe the adverse event. It is an unintended injury or complication which results in the disability, the death, the prolonged hospital stay, and it is caused by healthcare management. The how many kinds of adverse event we look that this is the delayed diagnosis or misdiagnosis. This is due to the adverse event is due to medication error, which we told you earlier. The wrong side surgery. It is the major. Uh, you may call it what I say the adverse event, that is the wrong side surgery. Patient has a pain on the right side, and they open the left side of the patient, the wrong patient surgery. This is also the adverse event. The file was of another patient, and the patient come towards the theater, um, which is another file, and surgeon was taking it clearly. So these kind of events happen in this world. The equipment failure and some sort of, you may say, the ventilators, they have some sort of in technicalities. Equipment fail to provide the sufficient amount of, you may call the oxygen, sufficient amount of air, or sufficient amount of what the moment required for this patient. The patient identity, miss the patient identity, transfusion errors. Another kind of error is transfusion error. The patient get transfused blood or platelets or plasma, they not required, and there is some documentation error. The mislabeled specimen, the specimen taken by the patient are the mislabeled, the patient falls, and the time delay errors, the laboratory errors, the miscalculation or the misreporting, the radiology errors, and the procedural error. Most of the time of the errors are, these kind of errors are due to the documentation error, basically. The labeling, the writing name of the patient, the file. So these kind of errors are only just due to, not only due to handling, but due to documentation error. There is also some sort of errors, the loss, the delayed or failure to follow up reports, the retention of foreign object following surgery. These errors are reported, are in this world. These are not out of this world errors. Contamination of drug and equipment during the drug development phase or during the production phase at the pharmaceutical industry side, or after the packaging, after the packaging, the during the transportation, the drugs may contaminate. Even when you receive the drugs or medicine at your counter and you dispense the medicine in a diluted form, during the dilution the drugs may contaminate, so there is a chance of error. And intravascular air embolism, yes, during the administration of IV injection there is some sort of air bubble and it may produce harm to the patient. Another one is failure to treat neonatal hyperbilirubinemia. Oh yes, this is another cause of adversities. Then next is the stage 3 or stage 4 pressure ulcers acquired after admission, and wrong gas delivery, death associated with restraints or betrayals, and the sexual or physical assault by healthcare professional to the patient. These sort of problems are also reported in this world, not out of this world, and all the healthcare professionals must aware about it and should monitor these kind of errors. Now come towards the patient safety. By achieving the objective of safe use of medicine, we ultimately have a goal of patient safety. So, what is the patient safety according to Canadian Patient Safety Dictionary in 2003? It described the patient safety as the reduction and mitigation of unsafe act within the healthcare system as well as through the use of best practices shown to lead to optimal patient outcome. That is the unsafe act by reduction of the unsafe act, by mitigation of the unsafe act in the healthcare system, the uses of the best practices, and it may lead to the optimal patient outcome, which ultimately describes the patient safety. What are the medication error? All these information is taken from a research paper, and you may also look at the slides that each slide have its reference on the below. So you may take a look on these references by copying from the slides. And this is the medication error. The definition of medication error is failure in the treatment process that lead to or has the potential to lead to harm to the patient. That may harm the patient or lead to the harm to the patient, and the treatment process involves all medication as defined above. जितनी medication हम यूज करते हैं अपने ट्रीटमेंट प्रोसेस में, वो सब की सब मेडिकेशन एरर कॉज कर सकती है. And medication error can occur in choosing a medicine irrational medicine choosing, or inappropriate selection of drug, or ineffective prescribing, underprescribing, or overprescribing of these all are the causes of medication error. Next is writing the prescription error, including illegibility, that is prescription to prescription error, also overwriting of the prescription, or one prescription, after the one prescription there is another prescription which is another kind of medicine, and it may also lead to medication error. The third one is manufacturing the formulation to be used with the wrong strength or contaminants or adulterants, strong or misleading packaging. This is for the compounding of the medication. That is during the formulation of the compounded medicine, the pharmacist may use the wrong strength or contaminants or adulterants. You may say the jars in which the raw material fixed, or the jars, or the laboratory equipments they may use to produce to formulate the medicines are contaminated, and there was the wrong or misleading packaging, the packaging errors, the sorry, the unstable packaging material or the contaminated packaging material may cause the medication error. Another was the dispensing the formulation, wrong drug, wrong formulation, wrong label. The formulation dispensed by the pharmacist was the wrong. Sorry. Yes, come towards the dispensing the formulation. The wrong drug, the wrong formulation, and wrong labels may cause the medication error, and administrating or taking the wrong drug or wrong frequency, wrong duration, and monitoring therapy failing to alter therapy when required, the illness alteration.